Let's talk about interviewing patients for a health history when you are obtaining all that data from them. It's one way to think about the interview would be that this is the opportunity for the patient to tell their story. And it is obtained through that interview process. So when you're doing health history, first of all, I want you to kind of think about it. Is it signs or symptoms? And I want you guys to kind of come back and tell me that. What do you guys think? It is subjective. It's coming from your patient. So keep that in mind. So there are 3 phases of an interview. First one is introduction phase. That will include you as healthcare provider or the nurse introducing yourself and then describing what's the purpose of the interview and describing how that process of interview will take place. Then there's discussion phase. That is facilitating and maintaining patient-centered discussion and using various communication techniques to collect that data. So by this time, you should have built that rapport with them, build that trust relationship. In the summary phase, you have to kind of put it all together for the patient too, and that should give you some time to clarify any data questions that you might have, or even patients should be able to clarify any kind of questions or concerns by asking those questions. So at that time, there should be clear understanding of the problems to both parties. So when you're doing the interview, some of the things that you want to kind of be careful about is the physical setting. You want to make sure like they are getting some privacy before you start asking them those questions, because there might be some data that you are collecting that might be very, very personal to the patient. And you don't want it to be like chaotic, people walking around anyways. That will be a big distraction. Next one would be personal space, where you are sitting versus where your patient is sitting. An amount of space patient needs might vary according to their previous experience in similar situations, or it can also be influenced by their own culture or whatever background they're coming from. So it's always a good idea to even ask them, are they comfortable, or is this arrangement workable for you? Second one would be professional behavior, and it starts with your own appearance. Dressing, grooming, if you're a nurse or nursing student, are you dressed appropriately in your scrubs and everything is neat and clean? Your interpersonal skills as healthcare provider would be crucial for a successful interview. Another point I want to make is you don't want to just kind of look at your paper. That is part of your professional behavior. You want to look at your patient when you're asking them questions, so they should be able to feel that you are showing genuine interest and not just filling that form there. So active listening. I'm sure you have heard that term before. So active listening is really crucial here. Because patients do have that need to feel understood, so we always want to kind of make sure that we are making that attempt, that we are understanding their point of view, and that we are communicating acceptance and treating them with respect. Otherwise, if they don't feel that way as a patient, they might even shut down, and it might jeopardize the flow of information there. So just kind of always listen first and then go back to your documentation. Another thing, when you are asking questions, make sure that you're using terminology that is familiar to the patient. But you have to be very, very careful when using any kind of slang words. You don't want to use any kind of terminology that might be offensive to the other person. But then again, you also want to make sure that they understand it, what you are saying. For example, so amongst slang words, when you're using the term breast tissue, that is appropriate for both parties. You don't want to use the other slang word for this one. But when it comes to, let's just say you have to ask them about their urination, they might not understand it. And depending on their developmental stage too, how often do you go urinate? That might be a hindrance to that interview flow of information. So you might want to use the term pee there. So that's just one example. And I see this all the time, and I have done that as a nurse, made the mistake of just going into the patient's room and saying, I'm going to grab a set of vital signs, and patient just looks at me. What? So breaking it down in simple language, that I will check your blood pressure and I will check temperature. So breaking it down in that manner. Vital signs, what does that mean for a layman? Also making sure that when you're asking questions, explaining it to the patient that they need to be as specific as possible. Always asking one question at a time and waiting for them to reply before asking the next question. There is another technique, that permission giving, that communicates to the patient that it's safe to discuss some topics that could be taboo. For example, when you're asking about any recreational drugs. So an example would be, many people have experimented with drugs. Have you ever used street drugs? Instead of just saying, have you been doing drugs or something like that? Using that non-judgmental language is very critical. The next step would be type of interview questions. So there are 3 types: open-ended, close-ended, and directive. With open-ended, you are just trying to ask that it's a broadly stated question so that they can describe something for you. So it will be more than 1 or 2 word response that you are trying to get from your patient. So it could be description of any kind of onset of symptoms in their own words and at their own pace too, because you don't want to make them feel rushed. The next one would be closed-ended. That's to gain more precise details. So it will be more direct and more specific. It might just require 1 or 2 words to answer it. For example, do you become short of air when you walk from this chair to that door? So that will be very, very specific question and close-ended. The directive question would be leading them to focus on one set of thoughts. So for example, if they have told you that they have been experiencing some drainage from their nose, and you want to know what coloration are they seeing with that one, or if there is any, other specific data that you want their attention to kind of get there. So asking them that describe the drainage from your nose would be an example of directive question there.